Hello everyone, so we're now just going to run through how to prepare your tray. So we have all the equipment out in front of us. We have our syringe, our IV extension, our drawing up needle, our flush with our saline in it. We've got our cannula, we've got two cannulas here so we can decide which one we're going to put in when we get to our patient. We've got some gauze, some alcohol, some 2% chlorhexidine alcohol for cleaning, our dressing, our tourniquet and our gloves. We would also obviously have a sharp spoon with us. So the first things we want to do is give our hands a bit of a clean so that we've got rid of everything that we want, and we want to make sure that our tray is clean. So, like we've done before, we clean on the inside first, make sure that the outside of the tray is then clean, and then we allow that to dry while we prepare the rest of our equipment. So, give my hand another clean, and then what I think I'll do first is I'll actually draw up my flush first, because then that is all out of the way and done. So I'm going to open up my syringe packet like we did in the Inflicted on Touch Technique video, and I'm going to do that now. Now the next step I want to do is I want to take my IV extension, and as this is a pipe that's going to connect onto the end of the cannula, it's currently all full of air. So what I need to do is actually fill this pipe with saline, so when we connect this to the cannula and then push saline through it, we don't push any air into the patient. So I just need to be able to push some saline into that until I can see it coming out the other end, place my syringe back into the packet, and then probably what I'll do to be a little bit prepared is take this plastic cap off the end of the IV extension, the end that's going to connect to the cannula. And then I can do a few other bits to prepare. So I'm going to open up my gauze, place that in the tray. I'm then going to put my 2% chlorhexidine in the tray. I'm then going to open up my dressing, take that out of the packet, and what I can do in order to prepare this is I can just fold over the middle part of this dressing, and I can just fold that over so that I've got something to hold on to, and I can also get to these flexible plastic strips here at the side to be able to stick my cannula down easily. I'm going to place that in my tray, put my cannulas in my tray, and then I've got my gloves and my tourniquet, and I'm ready to go and see my patient now. Okay everyone, so we're at the final stage now, so we are going to now insert the cannula into this patient. So I would have arrived at the patient, I would introduce myself and say, hello, my name is Tom, I'm a nurse, I'm here to insert a cannula. Have you ever had one done before? If the patient hadn't, I would then explain it's a flexible plastic tube that I'm going to insert into one of your veins, and give them a reason for me doing that, to give medication, whatever, safety. Then I'd get consent from the patient, hopefully they'd say yes. I'd ask them which arm they prefer. I would use my own clinical judgment to help with that selection, and I would ask them if there's any reason why I can't use that arm. Once I've established all those, I'll then go ahead and start preparing the patient and making them comfortable and asking them if they're comfortable. And then I'm going to get myself comfortable. Sometimes you may come across patients who have had lots of cannulas and loads and tons and tons and tons and tons. They don't want to hear the whole spiel every single time. It probably you have to use your own judgment as a human being as to whether or not it's necessary for you to go through the entire explanation or not, because some patients might get a bit frustrated if you go through that whole explanation every time. Okay, so I'll have a look over this patient's arm and I'm going to think, well, I've got a lovely vein just here, but I'm going to place a tourniquet over this patient's arm. Obviously, I've washed my hands and done all those different things. Once I can see this vein, and I might see if it comes up, I might even give it a gentle tap to see if it comes up, and I can see that I've got a lovely vein here which I'm really happy with. So what I can do is I can put my gloves on and I can then give the skin a clean with the 2% chlorhexidine. It is always important to keep in mind how long the tourniquet has been on for, and we don't want it to be on for too long, otherwise it might become uncomfortable for the patient. So once I've opened up my wipe, I'm going to give the hand a clean, and then I must allow the alcohol to dry so that it has actually worked. So I'll give that time to dry, and it probably won't be too long if your patient's skin is nice and warm. I'll put my cannula out of the packet, I'll prepare it, and I'll have a little look over it, and I'll hold it into the position that I want to, which is my middle finger and my thumb either side, with my forefinger on the actual port and holding it still. I must make sure that I can see inside this gap so I can keep an eye on the flashback chamber so I know that I can see that. So if my hand's too scrunched up I won't be able to see it, but if it's nice and back and relaxed I can find that. I'm then going to hold my patient's hand and stretch the skin so I've got really good skin traction and put it at an appropriate angle. So this is quite a shallow angle for the back of the hand. I'm going to go forward nice and slowly until I see flashback in the actual chamber. Once I see flashback, as you can see there, I'm then going to do this vital step, which is lower the cannula angle and then move forward a bit more. That just makes sure that the plastic tube is into the vein and not just the needle. And then I'm going to slide the cannula forward. Once the cannula's in and I'm really happy, I'm then going to release the pressure from the person's arm and vein by taking off the tourniquet and then sliding a bit of gauze just underneath the cannula, because now I'm going to take the needle out. I'm going to take my IV extension because I want to make sure that I keep that as clean as possible. I'm going to place my finger over the very tip of the cannula and I'm going to then pull the needle out and place it directly into the sharp spin. Try not to let any blood come out the end. And I'm going to screw my IV extension on, and once that's in, no more blood is going to come pouring out the end. Now at this stage, you can do whatever you want really at this stage. You can either stick the dressing down completely, you can not stick the dressing down completely, or you can stick part of it down, because what we need to do is we need to flush the cannula, we need to flush the blood out of it using our saline flush. What I personally would advocate you do is I would advocate that you stick part of the cannula down, and I would, so that secures it, and then I would then flush the cannula through. So now I've got that one out, I'm going to connect my syringe to my saline, and then I'm going to then ask my patient if they feel any discomfort. And I'm then going to look at their face and the back of the cannula to see if I can see any swelling developing on the back of their hand or if they're grimacing in agony in their face. Once I've established that, I'm then going to take that off, and then I can stick the rest of my dressing down. Now, like I said before, this is a nightmare trying to get this dressing on with gloves, so you probably could take your gloves off at this stage and then peel the back of the dressing off and then stick the dressing on to cover the cannula, making sure that you go all the way to the port. Tuck it underneath if you can, tuck it underneath if you can, stick it down, and try and get the front here, which can be a bit difficult, but don't worry about it if it is a bit of a difficulty. It just is difficult for everyone. Some people find putting the dressing on is worse than actually getting the cannula in the vein. Write my initials and date on this dressing, place it on the side there, and my cannula's all done. And that's it for my patient. So thank you very much. We hope these were useful, and we look forward to seeing you in August.